Catharsis doesn't work. Well, maybe doesn't's a big term, because never say never, but catharsis rarely works, certainly when it comes to trauma. There's a process from chemistry called titration, which is used a lot throughout the somatic world, and certainly Peter Levine in the somatic experiencing world, and Babette Rothschild's in sensory motor psychotherapy both use this term a lot to discuss how one works with patients and clients in the realm of trauma. Many of you might know I like visuals and analogies, and I describe it to patients to keep it simple. Is if you take a shaken up Coke bottle, and we all know, or a lemonade bottle, and you take the lid all off all at once, it just makes a mess everywhere, and you've got a big clean-up operation to do. So how do we do that? Well, we've all learned that the hard way sometimes. We just unscrew the lid slightly, then close it again. And we just let a little dissipate, we just maybe close it back part way. So we allow a dissipation, a gentle dissipation of something. And it's a whoo, there's a bit of a surge, right, oof, right. Oof, there's another surge, right. And the skill of a therapist is to find the rhythms, to be able to keep the patient in a space of safety, leaning in, a process called pendulation, where we lean into that. We just release a bit, and then whoa, there. How is that then? Now, does that mean that actually the body has got a small enough piece with enough tools and enough work that we've done to mean that they are in capacity and have the resources available within their system? Yeah. Not so much external resources, but their own resource, their own capacity to be in the system, to be able to go, all right, that is small enough for me to be able to process, and I can deal with that without feeling like it's going to just have to be overwhelming, and then my body behaves in the same way as it did at the original traumatic event. So if we are cathartic, it's like the Coke bottle, and it's just simply too much. The body couldn't cope with it then, and it won't cope with it now, and that's just going to re-traumatize the system and re-embed a pathway in the nervous system. So the titration, which comes from this chemistry idea, if you take an acid and a base and you pour the acid into a base, it just explodes. But if you take it one pipette at a time, then you can actually get small fizzles, and eventually you can neutralize it if it's done slow enough. This is why, the watchwords in trauma are generally slow everything down. If in doubt, slow it down, right? And that doesn't necessarily mean that we have to then slow the whole process down. Although, let's be honest, unfortunately, if we're dealing with trauma and we're dealing with stuff that's been there for our entire lifetimes, that may have come neurodevelopmentally, how we assume we're going to undo 5 decades worth of patterning on a nervous system and do that in a 10-week period, I'm sorry, it's not going to happen. And often, my work is I will work with people for months, maybe a year. It can be. We don't have to, and we can do smaller pieces of work, so don't let that put you off entering into some work. I'm not saying that, but certainly, to work with these things, we have to slow the process down within the session. That's the very least, is that we need to bring the body to feel safe and slow it down and just touch just a little bit of that Coke bottle fizz, just out a bit, let it settle, let it be in the capacity of the body, and the body then renegotiates and goes, oof, I've got that out, I've dealt with that, that's been, and now maybe the tears have come, or now maybe actually I feel like actually I don't freeze and I can push that person away that was attacking me or something. Then we can complete these responses in a way that the body needed to do at a time differently to the time when it was overwhelmed in that traumatic event. I hope that makes some sense. That cathartically punching punch bags, wailing at the top of our voice. I'm not criticizing it, I'm not saying it doesn't do you any good, but if we really want to skillfully work with trauma, then there's a better way, and that can be dealt with, but it's a delicate process and not one I think that you can really do on your own. So find yourself a good skilled trauma therapist to be able to work with. Hi, I'm Rodger. Thanks for watching the video. Hope you enjoyed it. And don't forget to hit the like and subscribe buttons.